Before penicillin began to become sufficiently available, the sulfur drug were the drug of choice in the treatment of infectious disease. Their popularity as antibiotic or antibacterial continued for decades even after the advent of penicillin and other antibiotics. So now what are sulfur drugs? Sulfur drugs are certain group of sulfur containing antibacterial drugs which are obtained by chemical synthesis and are used to prevent the growth of disease causing bacteria. This is a general structure of a sulfur drug. This R group can be varied according to the different synthetic procedure. Okay. So the action of sulfur drug is like it mimic uh, para aminobenzoic acid or PABA. So what is para aminobenzoic acid is this one COOH NH2. This para aminobenzoic acid is used in the synthesis of folic acid. That is sulfonamide combined with the PABA. This is PABA, which is an essential precursor in the synthesis of folic acid required for the synthesis of DNA and RNA in bacteria. So, since this sulfur drugs mimics this PABA, bacterial synthesis will not occur since it inhibit folic acid synthesis required for the synthesis of DNA and RNA in bacteria. So this bacteria will be destroyed. Okay, now we are going to see some examples of the sulfur drugs. This is sulfapyridine. Here, instead of this R group, here is a pyridine. In sulfadiazine, this is the diazine group. Okay. Then, in case of thiazole, this is the thiazole group. Then, sulfaguanidine, this is the guanidine group. These are some examples of sulfur drugs. Okay. Preparation of sulfur drugs. Sulfanilamide can be prepared from aniline as follows. That is, first we are taking aniline. Okay. Then it is treating with acetic anhydride to protect this NH2 group, CH3CO twice O. This is acetic anhydride. Then this group will become amide. So we get what? Acetaldehyde. COCH3. Okay. Then it is treated with the chlorosulfonic acid. ClSO2OH. Then this group is attached over here and we get NHCOCH3, then here SO2Cl. Then it is treating with NH3. Then we have N-acetyl sulfanilamide. Okay. NHCOCH3. Here SO2NH2. Then when it is hydrolyzed, we get sulfanilamide. Here NH3, then here SO2NH2. Here this is the group that causes the action of this sulfur drug. Okay, So the we have seen an R group is attached here in case of some sulfur drug. This R group is for pharmacokinetic effect. That is the rate of release of this drug into blood circulation and its lifetime. That is the purpose of the R group attached over here. So in order to attach sufficient R group here, instead of this NH3, we can add some amines. Okay. So for example, here we prepare sulfanilamide. Okay. Then its derivative can be prepared as follows. First of all, we are starting with the same precursor, that is aniline. Then it is treated with the acetic anhydride, CO twice O. Then what happens? Acetanilide is formed, NHCOCH3. So then it is treated with the ClSO2OH. Then we have but NHCOCH3. Here SO2Cl. Then it is treated with the RNH2 instead of this NH3. Okay, NH2. Okay. Then what happens is here this NHR group is attached. Here NHCOCH3, here SO2 NHR. Okay, then finally it is hydrolyzed to give our sulfur drug. Okay, NH2, here it is hydrolyzed. Then we have NH2 SO2 NHR. This is a sulfur drug. So this is the active part of this sulfur drug. In our body, this sulfur drug is hydrolyzed to this active form. Okay, so this the purpose of this R group is only its role is pharmacokinetics. That is the release of it into blood circulation, and it increases the lifetime of this drug. Okay, so let us move on to the uses of sulfur drugs. Okay, among about 20,000 sulfur derivative that has been synthesized and screened for antibacterial activity, about 150 of them have become commercial drugs. Okay, so now we are going to see some of the uses of sulfur drugs. Sulfur drugs, for example, sulfadiazine, sulfapyridine, etc., are used to treat bacterial infections such as urinary tract infection, prostatitis, and bronchitis, although they have largely been replaced for this purpose by new generation antibiotics. Okay, now this sulfur drug is replaced by new generation antibiotics. Even though it can be used as to treat bacterial infection. Okay, sulfur drugs, for example, sulfadiazine is used in the treatment of rheumatic fever in patients who are allergic to penicillin. The next use is sulfur drug, for example, sulfadiazine, sulfathiazole are used to prevent infection of burn and battle wounds. Battle wounds means the wounds that happens in a battle. For example, sulfathiazole are used very effectively during World War II to fight infection in soldier with the battle wounds. Okay, then sulfur drugs. Sulfur drugs, for example, succinyl sulfathiazole and sulfaguanidine has been used particularly useful against intestinal infections. Then some sulfur drugs are used to treat skin problems. For example, sulfapyrazine is used to help control dermatitis herpetiformis. Dermatitis herpetiformis. Okay, yes, it is a skin disease. Okay. Then some sulfur drug, for example, sulfur dioxin, are used in the treatment of certain form of malaria. Then some sulfur drugs, for example, sulfasalazine is used in the treatment of bowel disease called ulcerative uh, colitis. Okay. So it is used in eye lotions. Some sulfur drug is used for treatment of rheumatoid arthritis for reducing joint pain, swelling, and stiffness. However, resilience to sulfur drug have been emerged among many microorganisms, especially streptococci and meningococci. So the effectiveness of this drug is now limited. Okay, that's all about.